2022 open enrollment period begins Monday, February 28th and ends Friday, March 11th, 2022. This is the time for you to review your benefit elections and make changes as necessary. Open enrollment is all about giving you easy access to the benefits that help you live better every day. Explore your options for open enrollment, election updates, beneficiaries, and more. In this presentation, I'll go over the open enrollment basics. During this time, you can add, drop, or change coverage for medical, dental, and vision plans and the Healthcare Flexible Spending Account, or HFSA. The changes you make will be effective on May 1st, 2022. If no changes are necessary, your current benefits will remain in effect for the new plan year. With the exception of the HFSA, you must re-enroll in the HFSA each year. If you add any new dependents during open enrollment, supporting documents must be received by March 9, 2022, or coverage will not be added. What's new for 2022? Medical plan premium rates have increased for all plans. Out-of-pocket maximums have increased to Patient Protection and Affordable Care Act annual limits for all medical plans. As employees, you will enroll using the Employee Self-Service Portal at portal.houstontx.gov. If you need to reset your ESS password, contact HITS at 832-394-4487. Your eligible dependents include a legal spouse, natural, adopted, or stepchildren up to age 26, children up to age 26 over whom you have legal guardianship or legal foster care, grandchildren up to age 26 if they qualify as your dependents for federal income tax purposes and live with you. Ex-spouses are not considered eligible dependents unless a court order has been issued that states they need to be covered on your health plans. Contact your benefits office for full details on ex-spouse eligibility. Step-grandchildren are not considered eligible for benefits under any circumstance. Other eligible dependents include disabled dependents over age 26. In order to qualify, the dependent must depend on you for more than 50% of financial support, must be classified as disabled and covered on a medical plan before reaching age 26, and approved for coverage after age 26. If you have a dependent for whom a court order has been issued requiring you to provide health care coverage, you must provide the Benefits Division the court order within 31 days of the event. In all situations, the plan's eligibility rules and necessary documentation apply. The City of Houston requires that employees submit appropriate documents for all eligible dependents to be covered on health plans. The city requires proof of identity such as a Social Security card or individual taxpayer identification number, and proof of eligibility such as a birth certificate, marriage certificate, or legal adoption paperwork. Please be advised that you will also need to provide all dependents' Social Security numbers and dates of birth to enroll. The list of required documents is available on the Benefits Division website. If you are adding a dependent, you must submit your supporting documents by March 9th, 2022, no later than 4:59 p.m. Central Time. You can submit supporting documents through the Secure Document Submission portal at bit.ly/COH-benefits-form, or you can bring them in person to 611 Walker, 4th floor lobby. If both you and your spouse work for the City of Houston, you may be covered as an employee or as a dependent, but not both. Dependents may be enrolled under only one parent or guardian if both parents work for the city. Outside of open enrollment, the only other time you can make a change is if you experience a qualifying life event. A qualifying life event is a change in your situation that makes you eligible to enroll or change your health benefits. Some of the most common qualifying life events are marriage, birth or adoption of a child, divorce, gain or loss of other coverage, and moving outside the coverage area. You are responsible for notifying the Benefits Division of a qualifying life event within 31 days of occurrence. If you wait until after 31 days, you lose the ability to enroll or make changes until the next open enrollment. Next, we'll go over the medical plans administered by Cigna. The City of Houston offers 3 medical plans for our eligible active employees: a consumer-driven health plan, or CDHP, a limited plan network, similar to an HMO, and an open access plan, or OAP. Let's talk about how these plans differ. The CDHP offers a low paycheck contribution and includes a health reimbursement account to help you lower the cost for services. The city pays for the first $500 for an individual or $1,000 for family from the HRA, which can be used to offset your deductible or coinsurance cost. Under the CDHP, you have access to all Cigna providers throughout the country without having to seek referrals to see specialists. There are no copays in this plan, meaning that you'll pay 20% in-network and 40% out-of-network for the cost of your doctor's visits, hospital stays, lab work, x-rays, emergency room visits, and outpatient procedures after you reach your annual deductible. The in-network annual deductible on this plan is $1,750 for an individual and $3,500 for a family. The out-of-network annual deductible on this plan is $3,500 for an individual and $7,000 for a family. Remember that these deductibles are offset by the health reimbursement account. This plan also includes a 4-tier prescription drug plan. You'll pay 20% coinsurance for in-network pharmacies or 40% for out-of-network. Please take a moment to review the biweekly rates on the screen. These are the biweekly amounts so long as you and all covered dependents are non-tobacco users. The limited network plan allows you to choose from 3 provider groups: Kelsey-Seybold, Renaissance, and Village Medical. This means you will need to coordinate your care within these networks. In the limited network plan, you have a lower deductible and pay less for services. The limited plan has a $200 annual medical deductible for individuals and a $600 annual medical deductible for family. Additionally, you will have set copays for primary care visits and specialists. The limited plan has a $150 annual prescription deductible for individuals and a $450 annual prescription deductible for family, except for certain preventive medications which are not subject to deductible. The limited plan does not offer a health reimbursement account, so the city is not contributing towards the cost of services like in the CDHP. If you designate a primary care physician in the Village Medical or Renaissance network, you will need a referral from your PCP in order to see a specialist. If you designate the Kelsey-Seybold network, you do not need to choose a primary care physician. With this group, you can visit any Kelsey-Seybold office in the Houston and surrounding area. You do not need a referral to see a specialist as long as you stay within the Kelsey-Seybold network. At the time of enrollment, a PCP will be assigned to you based on your zip code. As soon as you receive your insurance card in the mail, please contact Cigna directly to update to a provider of your choice. You and your dependents do not need to be enrolled in the same network. For example, you may choose a PCP in Renaissance or Village Medical, while your spouse chooses Kelsey-Seybold. Please take a moment to review the premium amounts on the screen. These are bi-weekly amounts so long as you and all covered dependents are non-tobacco users. The Open Access Plan, or OAP, is the most expensive plan in terms of paycheck amounts. However, it gives you greater flexibility to choose your care than the other 2 plans. The OAP gives you access to Cigna's national network without a need for referrals to see specialists. The OAP has an annual deductible of $850 for an individual and $1,700 for a family. Once you have met this annual deductible, you will pay 30% coinsurance for most services until you reach your maximum out-of-pocket. You will have a set copay of $40 for primary care visits and $65 for a Tier 1 specialist visit or $80 for a non-Tier 1 specialist. The OAP includes a 4-tier prescription plan with no deductible. These are the biweekly amounts so long as you and all covered dependents are non-tobacco users. The 3 medical plans have differing copays and coinsurance amounts for prescription coverage. The CDHP has a prescription deductible that is combined with your medical deductible of $1,750 for an individual and $3,500 for a family. This plan also includes a 4-tier prescription drug plan. You'll pay 20% coinsurance for in-network or 40% for out-of-network. The limited plan has a separate deductible from the medical deductible, so this is an additional amount you will need to pay exclusively for prescriptions. The limited plan offers tiered copay amounts for different classifications. The OAP does not have a prescription deductible and offers a tiered copay and coinsurance amount for different drug classifications. Please review the cost for prescription drugs by verifying which tier your prescriptions fall under and carefully consider your options when choosing your medical plan. 90-day prescriptions have a higher copayment and coinsurance than 30-day prescriptions. Specialty drugs in the limited network and open access plans are only available as 30-day prescriptions. You can save money on your 90-day prescriptions by choosing Cigna Express Scripts. You'll pay just 2.5 times your retail copay for a 90-day prescription which can save several $100s a year depending on your usage. There are over 68,000 retail pharmacies in your network, which include local pharmacies, grocery stores, retail chains, wholesale warehouse stores, all the places where you may already shop. 30-day prescriptions can be filled at any retail pharmacy in the plan's network, including CVS, H-E-B, Kelsey-Seybold, Kroger, Walmart, and Walgreens. For 90-day prescriptions, you have the option to use a 90-day retail pharmacy in the plan's network, including CVS, Kroger, Walmart, or you can use Cigna Express Scripts. Visit mycigna.com for a complete list of in-network pharmacies. Pharmacies in which you can fill a 90-day prescription will be identified with a 90 symbol. Cigna has partnered with Cigna Express Scripts to offer savings on many generic and name brand drugs through mail order. Signing up for Cigna Express Scripts is easy and convenient with your prescription shipping to your home for free. Covered medications include generic and brand name asthma medications, generic cardiovascular and high blood pressure medications, generic cholesterol medications, generic diabetic medications, preferred brand diabetic test strips, and brand name insulin. Additionally, if you are a member who's not enrolled in Medicare, you are eligible for a free diabetic blood glucose meter. Call Cigna Express Scripts at 1-800-835-3784 to get started. Next, I'll go over the Vision Plan administered by Superior Vision. Did you know that eye health is an important component of your overall health? Eye exams can detect many chronic issues, including hypertension, autoimmune disorders, cancer, and thyroid disease. With the Vision Plan, there are no deductibles, just simple copays when you use in-network benefits. You will pay $20 for your annual routine eye exam and $25 for your glasses or contact lenses. The $25 eyewear benefit includes a $150 allowance toward your glasses or contacts, including single vision, bifocal, trifocal, lenticular, progressives, high index, and polycarbonate lenses. Additionally, if you are thinking about laser eye surgery, the Vision Plan offers a one-time $300 credit toward LASIK. Please refer to the City of Houston's HR Benefits website for more details. Superior Vision offers many providers to visit for your eye care needs, including iMasters, VisionWorks, Target, Sam's Club, Today's Vision, Walmart, Vision Source, and many others. To see a complete list of providers in the network, visit www.superiorvision.com. Next, I'll go over the dental plans administered by Cigna. The City of Houston is excited to offer 2 dental plans for eligible employees. You have the option to choose between the Cigna Dental Care DHMO plan and the Total Cigna DPPO plan. The Cigna Dental Care DHMO plan is a cost-effective plan that has fixed copays for dental services with no deductible or annual maximum on services. You will need to select a primary care dentist and will need a referral to see specialists. The service area includes all of the United States except for 13. Benefits start on May 1st. There is no waiting period. You will not have to submit claim forms on this plan unless you choose to use services out of the network. There is no charge for preventive services on this plan and fixed copays for basic and major services. If you enroll in this plan, Cigna Dental will automatically assign a primary care dentist based on your zip code. Once you receive your dental ID card, you may contact Cigna Dental to change to an approved provider of your choice. For more information on this plan, refer to cityofhoustonbenefits.org. The Total Cigna DPPO plan gives you the freedom to visit any licensed dentist or specialist. No specialty referrals required. The plan will cover eligible dental expenses after you satisfy any applicable waiting periods and meet any deductibles. The annual deductible is $50 per individual and $150 per family. The annual maximum benefit for Class 1, 2, and 3 expenses is $2,000. The plan is based on coinsurance levels that determine the percentage cost covered by the plan for different types of services. For example, Class 1 expenses are preventive services like cleanings and certain x-rays, and are covered at 100% by the plan. Class 2 expenses are basic services like extractions and root canals and are covered by the plan at 80%. And Class 3 expenses are major services like bridge work and crowns and are covered at 50%. To find out if your dentist is in a Cigna plan, go to www.cigna.com. Choose the Find the Doctor, Dentist, or Facility tab. Under How Are You Covered, select Employer or School. Enter the address, city, or zip code. Then select Doctor by type. Select General Dentist from the drop-down. Under Please select a plan, enter address, city, or zip after I live in and choose to continue. Select either Cigna Dental Care Access or Total Cigna DPPO, depending on which plan you are interested in. Review the list of dentists in the city which you typed in. If you need help choosing a dental plan, contact the pre-enrollment helpline at 800-401-4041. If your dentist is not in the Cigna network, you can submit a dental provider nomination form for contracting outreach. Forms are available at cityofhoustonbenefits.org, or you can request one from the Cigna pre-enrollment line. Next, I'll go over the flexible spending accounts administered by task. The HFSA is a voluntary pre-tax benefit plan that allows you to set aside money from your paycheck to be used to pay the out-of-pocket medical, prescription, dental, and vision expenses that you and your eligible dependents incur. You never pay taxes on the money you put into your account, giving you more bang for your buck when you use pre-tax money to reimburse qualified healthcare expenses. If you are a current HFSA participant and would like to remain in the plan, you will need to re-enroll to carry your HFSA over into the next plan year. Otherwise, your HFSA will end and you will forfeit any unused funds. How does the HFSA work? You'll select an annual amount to contribute. Consider how much of your healthcare costs were from the previous year. The total amount will be divided among 24 pay periods. The minimum annual amount you can contribute to the plan is $240, and the maximum is $2,550. There is a $500 rollover into the 2022-23 plan year, but any amount over that will be forfeited. After you enroll, you will receive a Taskmaster card in the mail. Use it like a debit card at your doctor's office, pharmacy, and more to pay for qualified expenses. You have 90 days after the plan year ends on April 30th to file claims with Task for any expenses that you weren't able to use the Task card to pay for. In addition to copays, coinsurance, and deductibles for medical, dental, and vision services, you can also use your HFSA for chiropractor visits, to pay for eyeglasses and contact lenses, LASIK surgery, bandages, first aid kits, hearing aids, medical equipment, lab fees, diagnostic services, and hospital services and fees. For more information about the HFSA, visit cityofhoustonbenefits.org. Next, I'll go over the 2022-23 Wellness Program, administered by the City of Houston Wellness Team and Cigna. Employees and covered spouses who participate earn a medical rate discount for the 2023-24 medical benefits. Step 1. Annual Exam. Get your annual exam by January 31st, 2023 to earn 40%. Obtain your biometric measurements from your annual exam. Your biometric measurements must be from February 1st, 2022 or later. You need up-to-date measurements for your blood pressure, total and HDL cholesterol, height, weight, and waist circumference. Step 2. Health Assessment. Use your up-to-date measurements to complete the online health assessment on mycigna.com between May 1st, 2022 and March 10th, 2023 to earn 40%. Complete Steps 1 and 2 to earn your Wellness Incentive Discount. Step 3. Wellness Engagement. Go the extra mile to complete the final 20% of the wellness program and earn extra rewards by completing one of the 5 wellness engagement options between March 14th, 2022 and March 10th, 2024. For more information about the wellness program, visit HoustonWellnessConnection.org. New hires whose medical benefits become effective on or after September 1st, 2022 are exempt from the 2022-23 wellness program. See the wellness website for a full list of exemptions. Take part in the Cigna Healthy Pregnancies Healthy Baby program and earn a reward. Where do you start? Sign up for the Cigna Healthy Pregnancies Healthy Babies program, designed to help you and your baby stay healthy during your pregnancy and in the days and weeks after your baby's birth. Find support early and often. Enroll today by calling 1-800-615-2906 and connect with Cigna through the Cigna Healthy Pregnancy app. Find the app in the Google Play or Apple App Store. Next, I'll go over life insurance, administered by Dearborn National. The city provides all elected officials, full-time and designated part-time 30 employees with basic life insurance. You will be covered for a group term life insurance policy at 1 times your annual base salary, rounded to the nearest $1,000. With submission of appropriate documentation, your spouse is eligible for a $2,000 life insurance benefit. Dependent children up to age 26 may also qualify for a $1,000 life insurance benefit. You have the option of purchasing voluntary life insurance up to 4 times your annual base salary. As a current employee, you may elect or increase your voluntary life insurance coverage at any time. An evidence of insurability form must be completed to be considered for approval. As a new hire, you may elect to enroll within 30 days of your new hire date and can select up to 3 times your base salary without completing an evidence of insurability form. You can add coverage for your spouse at half of your salary up to a maximum of $50,000 and coverage for eligible children up to a maximum of $10,000. To apply for voluntary life insurance for your spouse or children, you must be enrolled in voluntary life insurance as the primary insured. Premiums are based on your age, salary, and coverage options. Applicable rates are available on employee self-service at portal.houstontx.gov. The voluntary life insurance is a post-tax benefit, which means you can elect to apply, increase, decrease, or cancel your coverage at any time. All elected officials, full-time and part-time 30 active status employees of the City of Houston who have completed the initial waiting period may apply for voluntary life insurance. Duplicate voluntary life insurance is not permitted as follows: as both a city retiree and a city employee for the same benefit, as both a city retiree or city employee as a dependent of a city retiree or city employee for the same benefit, as a dependent of more than one city retiree or employee for the same benefit. Any individual found to have duplicate coverage benefit will be automatically dropped from the duplicate coverage. Here are some things to consider. Life insurance is not always so simple. Life insurance benefits cannot be paid to anyone under the age of 18 without legal financial guardianship documents on file with the courts. If you are interested in naming someone under the age 18 as your beneficiary, you must have proper legal documents drafted that allows them access to their funds. Otherwise, the funds will go into a trust until they reach the age of 18. If you experience any major life changes such as marriage, divorce, birth of a child, or death of a loved one, we strongly encourage you to update your beneficiaries with the Benefits Division. You can update your beneficiaries at any time. When you list your beneficiaries, remember that primary beneficiaries are those that will absolutely receive the amount listed. Contingent beneficiaries will only receive life insurance funds if the primary beneficiaries are no longer living. If you have elected life insurance coverage for your dependents, you are the only beneficiary on those plans. Next, I'll go over supplemental insurance administered by Continental American Insurance Company. The supplemental plans include Group Hospital Indemnity, Group Critical Illness with Cancer, and Group Accident Insurance. They will help you and your family against unexpected costs due to medical conditions and hospitalization. Individual and family supplemental coverage may be a good fit for some employees who want extra financial protection. The Group Hospital Indemnity and Group Critical Illness with Cancer are pre-tax benefits, which means you can only add or terminate the plans during open enrollment. The Hospital Indemnity Plan covers the costs associated with hospital visits and surgical procedures. This plan reimburses you after you file a claim, which can help lower the out-of-pocket expenses associated with unexpected medical conditions or hospitalizations. Some of the benefits include $100 per day for ICU stays, up to 30 days, a one-time hospital admission benefit of $500, $150 a day for hospital room confinement up to 30 days, $125 benefit for outpatient surgery, and a $50 benefit for health screenings. This is not an all-inclusive list, and some exclusions or limitations can apply. More information can be found on the Benefits Division website. The Group Critical Illness Plan pays a lump sum benefit if you are diagnosed with an approved major occurrence, including cancer diagnoses. You can receive up to a $20,000 lump sum payment paid directly to you upon diagnosis of cancer, heart attack, stroke, coma, major organ transplant, kidney failure, burns, and more. Additionally, you can receive a lump sum for reoccurrence benefits as long as they are 6 to 12 months from the original occurrence. This is not an exhaustive list of all covered occurrences, and some exclusions or limitations can apply. Please refer to the plan documents on the benefits website for more details. The group accident insurance helps cover the cost of expenses due to an accident. These expenses include ambulance rides, emergency room visits, surgery and anesthesia, prescriptions, major diagnostic testing, and burns. These benefits are paid directly to you unless otherwise assigned. Coverage is guaranteed issue, which means you qualify for coverage without having to answer health questions. Benefits are paid regardless of any other medical insurance. The supplemental plans are not eligible for enrollment through ESS. To enroll, you must either call Continental American Insurance Company at 888-687-1883 or 832-639-4453 or visit their website at wecareworks.com/wecare and use the login information provided. Next, I'll go over the Employee Assistance Program administered by the City of Houston EAP and guidance resources. The Employee Assistance Program, or EAP, is a free benefit provided by the City of Houston to employees and their immediate family members. EAP counselors work in a consultative role with managers and supervisors to address employee and organizational challenges. The City of Houston uses a hybrid model, both internal and external EAP. EAP offers confidential counseling that helps to address stress, relationship, and other personal issues you and your family may face. Our team is staffed with qualified clinicians who will listen to your concerns and can refer you to in-person counseling and other resources to help with anxiety, depression, and marital conflicts, problems with family, job pressures, grief and loss, and substance abuse. Additionally, our internal EAP offers several educational seminars throughout the year, including anger management courses, stress management, and more. Our external EAP partner, Guidance Resources, can help you address work-life balance issues by providing practical information and referrals for things such as child and elder care, educational options, community information, event planning, home improvement, buying or selling a home, relocation, and assistance with shopping or locating items. Through Guidance Resource, EAP can also offer legal resources, providing you with a qualified attorney in your area for a free 30-minute consultation and reduced legal fee rate. They can also assist you with financial information and resources by providing CPAs and financial planners who can assist with tax questions, retirement planning, and getting out of debt. If you have a problem, even if you think it's not a covered service, try contacting Guidance Resources. You can contact the internal EAP at 832-393-6510 or Guidance Resources at 855-378-7485. You can also email the EAP or visit the Guidance Resources website for more information. Final Paycheck beneficiary form is provided for you to elect a beneficiary to receive any pay which you would have otherwise received payable based on your employment. Pay includes but is not limited to wages, value of unused vacation accruals, compensable sick leave, modified sick plan, and paid time off owed to you upon your death as an active employee. Please complete the form available through the HR Benefits website, cityofhoustonbenefits.org. Please note that it also must be notarized if you are married but your spouse is not the primary sole beneficiary. You can also visit a notary public that is convenient to you. The Benefits Division has several notaries available at 611 Walker on the 4th floor. If you are a single participant or married with your spouse as the sole primary beneficiary, no notary is required. If you ever need to reach the Benefits Division, we are conveniently located on the 4th floor of 611 Walker. You can also reach us by emailing benefits@houstontx.gov or calling 832-393-6000. You can also view more information on our website at cityofhoustonbenefits.org.